Okay, so let's do a case from Wikipedia. Let's pick a quiz and see what we get. So let's start case quiz. Okay, so this is what we are getting. So it seems like an X-ray of the ankle joint, and we have a frontal and lateral views. If it let me see those two views. So what can we see? Of course, can see the bones, the fibula, the talus, the canals. See radiopaque lesions, maybe right over here. In a minute, we'll see what the patient or the referring physician wrote. Achilles tendon, maybe Castorines or something. I don't see any fracture. Okay. Painless distal of left leg swelling, 30 years old male. Painless distal of left leg swelling. So there is swelling somewhere right over here. I don't see any tumor, any periostal reaction, no lesions, no fractures. The bones look quite fine. Okay, what we're seeing, a broad-based bony overgrowth. Oh, whoa, this is a hard one. What? On the tibia, a broad-based bony overgrowth is seen in the medial aspect of the distal part of the fibula at the level of the distal tibiofibular joint. In addition, a few small soft tissue calcification. This is probably what we saw right over here. Are observed in the vicinity of the lesion. Oh, of the lesion. Better seen on the lateral view. I see those classifications. Maybe yes. Maybe this is what they're talking about. Yes, I think this is it. So, what is the diagnosis of this broad-based bony overgrowth? I don't know, chondroma or something. Let's see. Sessile osteochondroma. Feature of the surface of osteochondroma of the distal fibula. Osteochondroma. Osteochondroma, usually like there is a name, like a typical appearance. Yes. So osteochondroma. Relatively common in gene finding, occurring of all bone tumor, all benign tumors. Benign bone tumor usually they may be thought of as a development anomaly. They are frequently asymptomatic and have very low malignant potential if sporadic and solitary. Osteochondroma develop in childhood can grow during skeletal maturation, but once formed, regression or resolution is rare, so it won't go away. Risk factor, childhood total body irradiation, but usually they are frequently asymptomatic. Very low malignant potential if sporadic and solitary. Diagnosis is based on essentially cartilage cap, growth-like architecture, or extensive classification as age increase, by underlying stalk with medullary and cortical continuation with underlying bone. As you can see, it's like a stalk. This is what we had. It's quite good. There is a stalk right over here. Symptomatic presentation is either due to the mechanical effect of the lesion fracture or malignant transformation. Mechanical symptoms include hard palpable mass, lump, impingement upon nearby structure, nerve compression, vascular compression, reactive myositis, spinal compression, bursal formation of bursitis, osteoarthritis for secondary joint deformity, fracture post-trauma, most commonly around the neck of the peduncular lesion. Okay. Osteochondroma, chondroidenoplasma, it's from cartilage and are primarily part of the growth plate, part of the physis, which separates the continuation growing independently without association of physis, usually away from the nearby joint. You can see that the direction of the lesion is again away from the nearby joint, away to this direction. This is the direction of the joint. Most commonly arise from appendicular skeleton, especially around the knee, lower limb, femur tibia, less commonly feet. Radiograph picture as we saw and treatment, and they represent normal growth of bone plate in an abnormal direction. It doesn't stop growing with the rest of the skeleton. In most instances, no treatment is required. The osteoma can be locally resected for cosmetic or mechanical reasons. If malignant transformation occurs, 1% solitary with heredity multiple exostosis, then the resulting chondrosarcoma is usually of low grade, and surgery is usually curative. Limb sparing wine local excision is usually sufficient. The feature associated with sarcomatous transformation can be remembered by the growth after skeletal maturity, lucency, additional destruction, pain after puberty, and soft tissue mass, and thickened cartilaginous cup greater. So maybe there is transformation of to chondrosarcoma because I think they talked about a not too young patient, right? 30 years old with this at the level of the distal. In addition, if you why he came because he had painless distal of left leg swelling. We don't really know if it's new or not, but this is the growth. Quite hard to see that it grows away from the joint, adjacent joint, which is the tibia joint, or I think this is the no, I think I don't remember correctly. Okay, not very easy case. I must say, not very easy case. Um, Osteochondroma, usually benign, can go transformation to malignancy in 1% when it's solitary. Usually in the lower limbs, you saw that it should grow with a stalk, usually to the direction of the away from the adjacent joint. Really stop growing after puberty. Usually grows around the growth plate. So this is near the joint, as you saw, near the joint. And usually benign can be with transformation to malignancy. We saw the mnemonic for transformation, growth after skeletal maturity, lucency, additional synaptic activity, destruction, pain after puberty, soft tissue mass, all taking cardiac cap greater than 1.5 centimeters. There is a differential. You can see manual fracture, ace avulsion, myositis ossificans, which is after trauma, ossifications in the area of the muscles. You can see a very stalk and a cap away from the adjacent cartilage. We took rectus femoris heterotrophic ossification, ossification in the rectus femoris. So again, radiopaque lesions in the rectus femoris, pelvic digit, I don't know what it is. Humerus supracondyli spur projects toward the elbow joint. So spur is toward the elbow joint. I don't know, maybe around osteoarthritis. Osteoarthritis. Arthritis. I don't know. So spondylar supracondylar spur of the distal anteromedial humeral cortex is the anatomical variant, just anatomical variant. This is the supracondylar spur to the direction of the adjacent joint. This is what differentiates from osteochondroma. Usually points away from the joint. This is to the direction of the joint. Okay, in hands, bizarre periosteal osteochondromatic proliferation arises from the bone cortex and next medullary continuity. Okay, so thank you very much. If you have any, I don't know, corrections, please tell me. That's it. This was about osteochondroma. Thanks for Wikipedia, for the quiz and the knowledge, and that's it.